I'm Dr. Brian Kinney, and we're going to be demonstrating a ThermiTight procedure. This is the innovative new technology from the Thermi company, also known as Aesthetics. Thermi has a temperature control, a thermistor buried in the tip of the probe with a computer algorithm and an ability to monitor with the camera, internally monitoring with the temperature with the chip, externally monitoring with the floor camera, controlling the temperature above and below, and the ability to address different tissue layers that other devices on the market just do not have. Pain Thermi is a procedure under a local anesthetic with internal probes, smart monitoring above and below. A gentle probe will be inserted in this procedure under the tissues in the neck. We will address a little fat deposit, which we will show you in a minute, and we will address at 70 degrees some fat. We will address at 60 degrees the connective tissue, the fibroseptal network. So we've marked out here the area where we want to treat at 70 degrees. You could go a little lower, but if you notice here, this is only a few millimeters, and this is the area where it's 2.5 centimeters. Now, we want to treat throughout the platysma, as well as back on top of the sternocleidomastoid. Turn your head that way and tilt, and you can see here's the sternocleidomastoid. So we're going to treat like this. And of course, if you need to, you can treat inferior to the thyroid. But our incision, our access points will be here, behind the ear, in the mobile part of the ear, and then one in the middle, and then again on the opposite side. Here we have the treatment set up. Sterile towel, sterile gauze. This is the probe, the internal probe. This is the outer, here, the outer sheath, here with a stylet on the inside. Some infiltration cannulas, and you can also infiltrate here. Towel clips, a mosquito clamp, 30 gauge needle, 1 cc of 1% xylocaine, 1 to 100,000 epinephrine, a 16 gauge needle to make a small puncture site for the 18 gauge cannula, a couple of infusion cannulas, some betadine, the fluid for infusion, and a small bit of local anesthetic for the initial injection. This is all we need. We'll make our central insertion point in the midline in the submentum. Right here we'll inject a very small amount of 1% xylocaine, 1 to 100,000 epinephrine, so that we have access for our 16 gauge needle, where we will then be able to push the 18 gauge probe through it. So, small amount of local anesthetic, and then a little puncture site with the 16 gauge needle, like this. Okay, we have just inserted a 2.1 millimeter cannula, just gently, and then we will infuse a very small amount of the local, dilute local anesthetic, and then a little more, gently infused to cause spreading of the tissue planes, and also for anesthetic effect. And now you can see the area that we've marked out for 70 degree treatment for melting of fat. It's about 10 cc's, and we'll stop sealing. Now that we've infuse the area where we're going to treat for the fat, we're going to go on and work on the area where we're going to go for the rest of the neck. So now we'll go over to the side, and we infuse ahead of the cannula so it doesn't hurt as we go, and then we gently go forward. So we will take the internal stylet out. We'll take the external sheath off. We'll take the guard off of the thermistor RF wire, place it in like this. We have a tip here with a hollow infusion port on this side at the same side as the dot. We will now hand off. We are now going to set the temperature to 70, and we'll do it by hitting the up arrow in the middle section. We have been heating for 1 minute now at 70 degrees, and you see the temperature fluctuate slightly, 72, 71, 70, 69, back and forth. And I pull gently back. We have the cursor, it's set in the software that shows exactly where the hottest spot is. It's called the chase mode, and you see the crosshatches with the red triangle showing our area. I pull back. We're now at 1.5 minutes at 70 degrees with skin temperature at 38. There's just no other technology on the market that does this. We are simultaneously monitoring internal temperature, external temperature. We're heating the fat layer inside. We're heating the fibroseptal network, which is slightly farther away, at less than 70, and we're contracting the tissues underneath. And as you see as we go, that spot becomes larger and the skin temperatures slowly rise. And you see the temperatures are steady at about 70 degrees, plus or minus 1 or 2, as the energy is varied twice a second. If we go into an area that was less heated, the temperature goes down and then back up to 70 quickly as energy is applied, and we continue to move. And the temperature will go up slightly as we do this, 43, and we'll move to a new area, and another. This is a small area, so it will not take a lot of heating to get these temperatures. We will gently pause, and you can see we've been 2 minutes and 40 seconds in this small area at 70 degrees. Now that we've heated over 4 minutes at 70 degrees in the central midline, that should be enough to get fat melting. What we will do, temperatures 43, 44 are quite comfortable. We've already reached her max. She's going to start to go down. She has internal heating that will last 6, 7, 8, 9 minutes or even longer and get a very good tissue effect. We were treating the central fat deposit at 70 degrees. Now we want to treat this fibroseptal network at 60 degrees. This is the temperature at which we think collagen will have heat-induced cross-linking. So now we'll turn the temperature down from 70 by using the middle down arrow on the control panel. And you can see that the temperature internal is now at 39. She's been heated before, and we're going to start. So we'll apply our energy. We spent 4 minutes plus at 70 degrees internally, and here we go. We've now turned on the device, and we're starting to treat. And you can see the tip is about right here. And our skin temperatures are about 40. Internal now is 57, rising to 60. We know that if the impedance is about 130 or even less than 200 or 300, that there's plenty of fluid. If there's plenty of fluid, that means that she's not going to hurt because the anesthetic is there. What do you feel right now, Kelly?
Nothing.
Nothing. Not even warmth.
Not even warmth.
Not even warmth. So she's quite comfortable. Now you see the temperature hits 60. We go ahead and move. We do not wait for the skin to change, the colors to change on the monitor, because we know that that will lag behind by 1 to 2 minutes. This is heating internally of the tissues, conducting the energy to the surface, and then radiating it out so it can be captured by the infrared camera. Now we're internal, and if we look here, we can see that's just at about the margin of where we treated from the midline posteriorly, and now we're going to join these areas from here to here, and I'm going to show you this. Right there is where we're going to treat, between my fingers. So I'll start. The temperature is at 34 internally. We've been heating for 9 minutes. We've got a set temperature of 60, and we're going to begin to see filling in this zone here on the FLIR map. We're at 58, 59, and you'll see the temperature's 60. It may fluctuate 61, 59, 58, and if we move very gently, the temperatures will stay very steady. And you see I'm just pulling bit by bit with my fingers, maybe 5 millimeters per second, and already you can see there on the camera where the area of heating is showing up as a warm spot, as if the sun was just rising slowly. And now it's the warmest point in the field. The cursor has just jumped to that area. Now I'm going to push forward again, and we'll find a slightly cooler spot, about 55, and then heats up. And here we go. We've now used the left earlobe access point to finish our treatment, which is demonstrated on the FLIR camera in a minute as we pan over there. But we want to treat from about the mid-lateral line, anteriorly halfway towards the midline. So we're going to start now, turn on our temperature, our heating, and we'll go up towards 60 again. The temperature rises relatively quickly. You saw it accelerate up from in the 30s to 60, and there we are. And you will see the spot appear on the skin as the heating from inside comes to the outside. We apply the energy. It rises from the 30s up towards 60, and you can see the area here that we're going to be treating, and we're going to even treat a little more inferiorly down to the second fold. So I will gently advance here, and we can see what happens on the patient here, and you can also see on the camera. Now we've joined the area where we previously heated, and we're going to pull back gently. We're at 60. And if we pull very gently, probably 5 millimeters per second, it'll be very even heating, which you'll see appear. Now notice that the probe is actually touching her ear, but she's not hot here. This is insulated. This is cool to the touch. We are applying the heat where we want it, not spraying a blast of energy and hoping the tissues receive the right amount. One of the things that's fascinating about the FLIR camera and infrared imaging, the obvious thing is safety because you're looking at skin temperatures, but this is also towards efficacy. When you can actually paint this entire area, as we call it, in slow motion, you are actually be able to map out in real time what's happening to your tissues deep, what's happening to your tissues superficially, and increase your therapeutic efficacy. You can actually adjust your movement of the probe guided by the infrared feedback that you have, as well as the real-time, twice per second tip feedback of the active temperature. If you move suddenly and dramatically, you'll see the temperatures drop. If you move slowly and gently, you'll find that the temperatures stay very steady. The more steady the temperatures are, the more even and therapeutic your heating is. So think of this as not only a feedback loop for the tissues, but a feedback loop for operator efficiency and operator control. It's like the metronome for that your piano teacher would use for you to keep you on time when you're learning how to read music scales. ThermiRF is a new technology that applies the science of heat using temperature control to solve problems in my clinical practice otherwise unaddressed by other technologies.